Hello, everyone. My group and I, with Anne, Francesca, Jeanette, Preeti, and Sam, are doing a presentation on dealing with chronic pain using evidence-based practice strategies. Chronic pain is a global epidemic affecting over 30% of the world's population. It can be defined as pain persisting for longer than 3 months that extends over the normal healing period of an injury or illness. Chronic pain may arise from conditions such as arthritis, fibromyalgia, muscle disorders, and more. Within the United States, it is estimated that 50.2 million adults suffer from pain on most days or every day, with 1 in 5 Americans living with chronic pain. Individuals experiencing chronic pain are found to have a decreased quality of life, reporting limitations in daily functioning, including social activities and activities of daily living. In this video, we are focusing on 3 different types of therapies to help you cope with chronic pain, such as acceptance and commitment therapy, cognitive behavioral therapy, and mindfulness-based stress reduction. Pause the video here if you would like to read an overview of each one. We'll be focusing on these in detail later, but wanted to illustrate the benefits of each one in the treatment of chronic pain. Acceptance and commitment therapy helps one with pain-related functioning increase their quality of life and decreases pain catastrophizing in depression or anxiety. CBT can help reduce negative thought patterns, increase one's sense of control over their pain, and help with problem-solving skills. Lastly, MBSR can enhance one's coping process, improve their emotional regulation, resilience, and more. Now we'll be moving on to Jeanette with ACT.
Thank you, Anne. So, moving on to ACT. ACT addresses pain by trying to live a meaningful life with it rather than trying to eliminate it. This does not mean we're giving into or approving the pain, but recognizing that it exists and that we're working with it. In the following slides, I'm going to practice 2 activities with you to focus on acceptance and mindfulness because those are the aspects found to be most useful in research. So this first activity is passengers on the bus, and we'll be practice acknowledging these thoughts and feelings that come up when we're experiencing the chronic pain by redirecting our focus towards meeting our goals instead of those thoughts. So first, you want to identify these thoughts or your passengers. What thoughts, emotions, and memories tend to show up and derail you? And what do they say or try to convince you of? For instance, you might say, I took all my medications and exercises, but I'm still in pain. Maybe it's my fault that I'm not better. Then you want to name and externalize these passengers. So for that phrase, you might name it catastrophe or short for cat. Um, and then you'll acknowledge their presence without engaging in them because engaging can lead you to continually ruminate on those feelings instead of focusing on your goal. So instead, you might say, thanks for the input, Cat, but the thought is not helpful for me, rather than continuing to engage in that. And then when you do that more and more, you get to practice keeping your hands on the wheel, or in other words, focus more on your goals. So for the second activity, we have clean versus dirty diary. So this basically categorizes your chronic pain from the additional pain you might add on to it, which is your dirty or secondary pain, such as rumination, self-criticism, and avoidance. Um, so take a minute to practice this on your own or throughout at the end of the day to recognize how much additional pain you're adding onto your experience of chronic pain. Is it really your chronic pain or is this additional dirty pain you're adding? Does it benefit for you to keep engaging in these dirty pains? The more you recognize these thoughts as additional pain, the less power it can hold over you. Now we will move on to CBT with Preeti and Francesca.
Okay, so now we're going to talk about CBT, cognitive behavior therapy. It's a psychological approach that focuses on the connection between your thoughts, emotions, behavior, pain, like a physical sensation. In chronic pain, negative thoughts pattern can actually make pain feel worse. For example, someone experiencing pain may think this will never get better, which increases stress and anxiety. And that stress can intensify the physical pain itself. And this creates what's called the pain cycle. Pain leads to the negative thoughts, which increase stress, which then increase pain even more. CBT helps break this cycle by changing how people think about, respond to the pain. one important skill is cognitive restructuring, where patients learn to identify and challenge unhealthy thought patterns. Another is activity pacing, which helps people balance activity and rest instead of overdoing things on a good day and crashing afterwards. So, CBT also uses behavior activation, which encourages patients to stay engaged in a meaningful activities because isolation and inactivity can actually worsen both mood and pain perception. Relaxation technique could be like deep breathing, muscle relaxation are also some of these commonly used to reduce pain, stress, and attention. Some important concepts connected to CBT, including biosocial model, which recognizes that pain is influenced by physical, emotional, and cognitive factors, as well as fear avoidance cycle, where fear of pain lead to avoidance and reduce functioning over time. CBT also targets pain catastrophizing, which includes pain like helplessness, rumination, and magnifying pain. Overall, CBT doesn't mean that pain is not real. Instead, it gives patient practical skills they can use daily to manage their chronic pain, improving functioning, and regain a sense of control over their lives. Now, we move on to talking a little bit more about CBT.
This exercise here is called an ant, catching ants, which helps us identify automatic negative thoughts that can contribute to the pain cycle Preeti had mentioned earlier. These ants can show up during pain flare-ups. This exercise has 3 steps. Catch the ant by noticing the thought without immediately believing it as fact. Notice the feelings behind it, and challenge it by offering a more balanced and more realistic alternative. For instance, you may think of an ant like, I can't do anything because of my pain. A more balanced thought might be, my pain makes things harder sometimes, and I could still take small steps. After this, you can choose a small action, like tidying a small area of your room, going for a short walk, or texting someone you trust. And this might reinforce a more balanced thought. Feel free to pause and fill in the table using your own example. And remember that this is not about fixing every thought, but about noticing the patterns and building awareness to how your thoughts affect your constant experiences of pain. And now we'll move on to MBSR with Anne.
So MBSR is a program created in 1979 by John Kabat-Zinn, as I've shown here. It is a program that aspires to improve one's capacity to manage stress, pain, and promote all-around wellness. It tends to incorporate mindfulness meditation, body scans, awareness yoga, and more. And being present and non-judgmentally accepting the experiences is crucial in MBSR, as it involves paying increased attention to the body and the pain. By acknowledging the pain and relating it into a different way, the patients bring more consciousness to the actual pain condition. Mindfulness is not targeted at minimizing pain, but rather at changing the relationship with pain. MBSR has been effective with pain tolerance, chronic pain, stress, anxiety, depression, and more. And now Sam will lead us in a body scan exercise.
This is a shortened body scan to introduce you to the exercise. Take a moment to get into a comfortable position and close down your eyes. Begin by noticing your breathing, feeling your belly expand on each inhale. Now bring your focus to the soles of your feet. Just notice any warmth or coolness there. Is there any tension or tightness? Do not label it as good or bad, just notice that it is there. Maybe it feels heavy or light, or pleasantly numb. We are now going to continue to gently move our focus around the body. Place your attention on your knees. Are they warm, cool, tight, loose, heavy, or light? Now move your attention to your chest and see how it feels. Take another moment to just feel your belly rising and breathe. When you are ready, you can gently bring back your attention to the room you are in, and you can slowly open your eyes and welcome back. In summary, practices from acceptance and commitment therapy, cognitive behavioral therapy, and mindfulness-based stress reduction provide us with accessible and applicable tools. It is often helpful to find which ones work for you and practice them to bolster your resources for coping with pain and improving your quality of life. Thank you.